Well, thank you very much for the introduction. We have no disclosures. I will present a study to reduce wound leakage in arthroplasty with a modified wound closure method. Prosthetic joint infections are a major complication after arthroplasty and have devastating consequences for our patients. They are an increasing problem, and we tried to find a way to reduce their incidence. After analyzing our own PJIs, we had two important findings. First, most of our PJIs had prolonged postoperative wound leakage prior to their diagnosis. Current literature associates wound leakage and PJIs. It is discussed whether wound leakage is the result of a per-operative obtained PJI or whether contamination of the leaking wound, which actually is an open wound, leads to a secondary obtained PJI. That makes our second important finding very interesting, because we found some atypical microorganisms within the cultures of our PJIs. These microorganisms normally do not occur in an operating room, and hypothetically they might have caused the PJIs because of contamination by, for example, the hands of the doctor, the nurses, or the patient itself, and lead to a secondary obtained PJI. So those two findings endorse a possible causal relation between wound leakage and secondary obtained PJIs. That's why we did two policy adjustments. First, we modified the wound closure method, and secondly, we also adjusted our post-operative wound care management protocol. The study I'm talking about today has evaluated the modified wound closure method. Arthroplasty wounds used to be closed in 3 layers. First, the fascie, secondly, the subcutaneous tissue, and finally the skin was stapled. We've added an extra layer in the study group, so a nearly watertight continuous subcuticular bonding stitch was added between the subcutaneous tissue and the skin. From January the 1st, 2017, all of our surgeons performed the modified wound closure method. Data of all total hip and knee arthroplasties were obtained for 1 year in the study group and for 1 year in the control group. It has to be mentioned, no other policy adjustments were done during the whole study period. So there were no exclusion criteria. I do have to mention that the knee arthroplasty group existed of total and unicondylar knees. The primary outcome of this study was the incidence of prolonged postoperative wound leakage, defined as any fluid coming from the wound from 72 hours after surgery. The secondary outcome was the incidence of PJIs, and complications due to the intervention were registered. Data was obtained from the Dutch Arthroplasty Registry and medical files. Baseline characteristics were tested for significant differences between both groups. If these were present, we tested them for confounding. For analyzing the incidence of prolonged postoperative wound leakage, we used a logistic regression, and for PJIs, the Fisher's exact test was used. 3 significant differences in baseline characteristics were found. They were tested, but were no confounders. These are the results. The incidence of prolonged postoperative wound leakage highly decreased, and we found very low odds ratios. This means that the modified wound closure method has a high protective effect on obtaining prolonged postoperative wound leakage. The results all are significant and also clinically relevant. A similar trend was found in the incidence of PJIs. When the group was split into hips and knees, decreased incidences were found, but they were not significant due to the sample sizes. When the groups are combined, we do find a significant result, and it's also clinically relevant. We found 4 times less PJIs in the study group. The results of this study are in line with current literature. However, there are some limitations to discuss. First, it's a retrospective study, which is not the highest level of evidence. And furthermore, we've chosen several important possible confounders to test and correct for. But to correct for all possible confounders or parameters that might influence developing prolonged postoperative wound leakage, groups should be expanded to major amounts of patients to obtain enough power for significant results. This was not possible at our hospital. Also, the decreased incidence in PJIs was the result of a combination between the modified wound closure and the adjusted postoperative wound care management protocol. So in conclusion, the modified wound closure reduces the incidence of prolonged postoperative wound leakage, and in combination with the postoperative wound management protocol, it also reduces the incidence of PJIs. Despite the limitations of our study, we did find a way to reduce the incidence of prolonged postoperative wound leakage and PJIs. And it was done by a very simple implementation and very low costs. I'd like to thank my team for making this study possible, and I'd like to thank you for your attention.
So our